As the country slowly progresses towards level 3, medical aid costs for COVID-19 admissions, including the medical aid payment holidays, are becoming a concern. The Board of Health Funders says there's a high likelihood of a rebound where people may fall sick and not be able to go to hospital on time due to fear of COVID-19 infection. And this may lead to complications and fatalities not related to COVID-19, but due to delayed treatment or hospital admission processes. So how will medical aid address this? Let's ask Dr. Katlego Mothudi, who is Managing Director of the Board of Healthcare Funders. Thank you very much for coming through, sir. Firstly, will medical aid subscriptions be affected when it comes to payment holidays for medical aid scheme members?
Afternoon, Colin. In terms of what we expect from the discussions in the industry, the issue of payment holidays was muted because of, firstly, the banking industry's response to COVID-19. Now, the industry is not as easy as maybe has been promulgated through the banking sector because there is tight regulation by the Medical Schemes Act with oversight played by the council. So the issue of payment holidays was one of those elements that was considered to afford relief to those beneficiaries who find themselves with financial constraints. There are a few processes that the industry has engaged with. The first thing was to engage with the council to consider whether that was an option. But by that time, there were some schemes that had already considered giving that as an option. The second thing was to look at their own scheme rules. And these are overseen by their trustees to ensure that whatever it is that they decide will be in accordance with the law. Now, maybe just a comment on what the likelihood is. What has been punted was that some schemes had said that they would consider holidays, but then also not provide benefits for the time. This is in the light of the normal processes usually being, if you cannot afford payments, you are usually suspended or even terminated from the schemes.
So now, what can medical aid scheme members who are under financial distress do so that they can be able to shoulder the burden of the payment of premiums during this time? And you will remember that when you deal with medical aid members, you deal with those who are subscribed under the ambit of their companies. And there are those who may quit their company medical aid schemes and go the individual route. So, but then a subscription is a subscription. An infection or a hospital admission or treatment or consultation with a doctor may not really matter when a person falls ill at that time.
Okay. So there are already some interventions, and let me go through some of the proposals. So for those beneficiaries or members that join schemes through their companies, there are some companies that have opted to pay the full subscription. You remember the normal process is that there might be allocation from the employer and then the other one from the employee. So there are some agreements between some of the schemes to say that the employers would actually shoulder the entire subscription. Those beneficiaries who are not under contract through their employers can approach their schemes directly to see whether the schemes have applied for exemptions, because some of the schemes have indicated that they do have some process allocated for that. There's been a number of things suggested whether schemes could access reserves, but they have to be careful because those are tightly regulated as well and they are largely for claims. Some schemes have or proposals had been under us accessing what they call an ex gratia grant from the schemes. So my advice would be for those beneficiaries or members that are under financial pressure, they contact their schemes directly and they see what arrangement has been made in that regard.
All right. Thank you very much for making time to speak to us. We will do follow up on this, more especially that it's not always possible for medical aid claims to be successful, as some claims are declined because of medical complications or technicalities regarding the claim process. But we will follow up on this matter, and then we will have to engage you in our further discussion. But for now, thank you so much for your time.